Hey, it's Laura from Train to Respond. Thanks for stopping by. This is the last in our series on the deadly triad of trauma, and in this video we're going to go over treatment. How can we make a difference for our traumatically injured victims or patients? So managing the deadly triad, first, number one, is find all the bleeding sites and stop the bleeding. So that's going to be direct pressure, pushing down as hard as you can on top of the wound so you can stop the bleeding. If that doesn't stop, we're going to immediately go to a tourniquet and apply a tourniquet. Tourniquets are no longer last resort. They are our go-to tool now when you have somebody traumatically injured who has an arterial bleed. If it's in an area not amenable to a tourniquet, then you can use hemostatic gauze if you've been trained in it. So basically, find the bleeding and stop it. Second, I want you to think about if the patient is lying on a cold ground or you're about to move them onto some type of lifting device like the scoop or backboard, to place something underneath them. Because if they're going to lay on the cold ground or they're going to lay on the cold lifting and moving device, you can throw all the blankets you want on top of them, but they're still going to get cold and hypothermic. So we can do a lot about that hypothermia. Also, you want to expose only areas of the body that you really need to assess and treat, because our main goal is to keep them covered and keep them warm. Remove all wet clothing or bloody clothing and replace it with a warm blanket. That's important as well. Turn up the heat. I say if you're in the back of the ambulance or in your vehicle transporting to a trauma center because EMS is overwhelmed at an active shooting, as we've seen in many of these active shootings, bystanders are the ones pitching in to save folks. Turn up the heat. If you aren't sweating, it's not hot enough. That's our main goal, is to keep the patients warm with that. And you always want to keep in the back of your mind, no matter what season it is, if you have a traumatically injured victim, they are getting cold. They are becoming hypothermic. So let's try and stop that. You want to monitor the airway, and this is for really EMS, fire, police who have ability to ventilate with a bag valve mask or a pocket mask or whatever. If they start breathing shallow or breathing not at all or too slow, we're actually going to start ventilating them. And by ventilating them, this can actually start, one, it's going to help them breathe, get oxygen to their cells, but two, it's also going to start blowing off some of that acid and help them prevent them from becoming acidotic. And obviously, you want to get them to the appropriate hospital. You want to get them to a trauma center. So that's why it's so vital. Like, if you're in some other part of the country, we saw Las Vegas when that shooting happened at the outdoor movie, or not movie event, it was the outdoor music festival, right? And then Orlando in the nightclub. We saw bystanders pitching in. Bystanders, because EMS is overwhelmed. You have so many patients, they can't possibly cope with it. So people who are there who just pitch in and they start becoming the first responders. I call them bystander first responders. We saw a lot of bystander first responders saving people's lives by, one, direct pressure if they had a tourniquet on. And we're all saying you should be carrying a small first aid kit on you. You should be trained in bleed control and how to use tourniquets. And when you go to an event, you should be carrying them with you. And we've seen that. So you want to know if you're going to an event, God forbid, an active shooting or mass violence takes place, you know where the trauma centers are, so you can load the victim or yourself into a car and start going to the trauma center. Our main goal when we're out there that we can do as bystanders or EMS is to stop the bleeding and keep them warm and get them to the right hospital. So I hope you've learned a bit from this series, and I'm going to have some more videos coming up, and hopefully I'll see you in them. Thanks again for stopping by and for learning about the deadly triad of trauma. Have a great day.